All right. Hi, everyone. Today we are going to cover health literacy. I know the first of the slide says health common culture, but it is health literacy today. So let's get down to it. Health literacy is the ability to access, understand, and apply health information to make informed decisions about one's health. Sometimes this does include the ability to access the healthcare system. So can I find resources that I need? Can I understand them, how they're written, and can I apply that health information? It is increasingly recognized as a major issue in health communication and healthcare access, not across, sorry. Half of Americans have trouble understanding and acting on the health information. Think about when you've gone to the doctor and they give you that pamphlet, right? They maybe don't explain it well enough. And so we don't understand. We don't know what we're supposed to be doing. So a big focus of health literacy is to improve accessibility, quality, and safety of healthcare. Starting to make a similar shift to how culture and health is viewed, we're viewing health literacy as well. It's a privileged view on literacy versus critical perspective on what it means to be literate, right? So we know the term literate and illiterate. So it is kind of this privileged term. So to be health literate, one must know how to read and understand the language. That's already a big disadvantage for so many people. Have access to reliable and relevant information. Again, if you live in an area where there's only one doctor, you might not have access to the best quality information. Be interested and able to discuss health matters with others. Be able to hear and or see. Know how to apply the health information. Be willing and able to put the information to effective use. So with health literacy, to be health literate, you have to have all of these qualities. You can't just miss out on one. So people experiencing low health literacy have difficult with written and oral information from providers. It's not explained to them in a way that they understand. The wording on pamphlets or anything else just doesn't make sense to them. They have limited understanding of preventative screening and symptoms, so they don't know much about why they're doing what they're doing or healthcare for that matter. They experience higher hospital admission and readmission rates. So they go home from their doctor's appointment. They're not doing what they're supposed to because they don't know what they're supposed to do. They don't understand it. And then they come back. They're at risk for lower quality of life and puts an undue burden on the healthcare system. Because they don't understand how to take care of themselves, it starts to put a burden on the healthcare system because they're constantly using those resources. And they have a lower quality of life because they can't make the change to have a healthier, happier life. They avoid asking questions and disguise comprehension issues. So they do this despite a collaborative relationship with their doctors. They don't ask questions that they need. And they make it seem like they just know what's going on, even though they don't. So they disguise those issues. Sorry. They tend to be older, experience poverty, and have less formal education, and be non-white. These are all factors that contribute to health literacy issues. So how is it measured? Assessments of a measure or a message's health literacy are expressed by grade level. So there's no correspondence by actual education and reading level. Most US adults read below a 5th grade level. So that's important to note that they read below a 5th grade level. But medical texts often exceed 12th grade reading levels. So directions, informed consent, social service forms, health education materials, those all exceed a 12th grade reading level. So while most individuals are reading at a junior high level, medical texts are more like a college level. So the most popular tests, the first is the rapid estimate of adult literacy in medicine, or REALM, test of functional health literacy in adults, TOEFL, and newest vital sign, NVS. So let's talk about the realm first. There are 66 items to identify and pronounce medical terms. So the short form, it's about behavior, exercise, menopause, rectal, antibiotics, anemia, jaundice. So if you score a 0, you have less than a third grade reading level. And that means that you need repeated oral instruction, materials with mostly illustrations and or audio and video. 1 to 3, you have a 4th to 6th grade reading level. You need low literacy materials, but you may not be able to read prescription labels. 4 to 6, you have a 7th to 8th grade reading level. So you struggle with patient education materials, you will not be offended by low literacy materials. And 7, you are able to read at a high school level, you'll be able to read most materials. Now, let's talk about the short assessment. Give me 1 second. With the health literacy for the realm. There are individual cards for each. You choose the related word. Is this the, no, okay. Well, this is just short assessment of health literacy. So there are individual cards for each. You choose the related word. The correct is the right choice and correct pronunciation. So you have to have both. And 0 to 14 is low literacy. So if you look on the slide, the stem is kidney. There's a key or disorder. So kidney, I don't know, loss. And then if you get both right, the stem and the key or disorder, then you get the correct. There's also a marking for don't know, and you would get that incorrect. So with test of functional health literacy in adults, or TOEFL, you fill in the blank on 2 medical intake forms. You choose from 3 words for each blank. The issue with this is that it does have to be paid for to be used. So your doctor has sent you to have a stomach x-ray, a diabetes x-ray, can't read the third word, or germs x-ray. The correct choice would probably be stomach, although I can't tell what the third word is. So with that in mind, you would have to fill in the blank for which x-ray you would be getting, right? Again, downfall is you have to pay for it to use it. All right, and now we talk about the newest vital signs. This is created to be more real world. You interpret a nutrition label, but it doesn't always predict the outcomes as well as the realm or the TOEFL, right? So if you eat the entire container, how many calories will you eat? So you answer these questions, and then the interpretation suggests your literacy skills below. There are some conceptual issues with health literacy. First, there is no consistent measurement. All 3 are used across the board. It's overly focused on reading comprehension of medical terms. The message level variable, so how complex is the text? And there's a person level variable, so how difficult of text can they read and understand? Okay. So optimal communication can be difficult. Organizational constraints prevent full assessment of health literacy. They also might lead providers to overly focus on text materials and forms over appropriate oral communication strategies. So here's the directions, go home and read them rather than let's talk about it. It prevents patient-centeredness and empowerment making it difficult to adhere treatment plans and self-management. If they don't understand what's going on, then how are they supposed to self-manage and treat? It might also be breakdown conversation. Health literacy is not just a risk factor to modify messages around. Health literacy is also a skill that can be developed. We become more critical consumers of health information. We have critical health literacy, which moves away from basic reading and comprehension. We understand the system and how things affect one's health better. And those with low health literacy are not incapable of complex thought. Uh, they're just operating in an unknown space. So, strategies to navigate health literacy: use simple words and sentences, reduce the use of jargon and specialized terms, and words with atypical or complicated spellings. Syntactically, use simple sentences. Repeat main ideas, use narratives, have them talk through the ideas in their own words, and directly point out where the information in a document is. These can all help navigate. Now, also a focus on media literacy and scientific literacy. So, what constitutes as literate and rooted privilege? Some skills and knowledge needed rely on formal education in science, statistics, and critical analysis. So, we rely on education, on science, on statistics, on critical thinking, critical analysis. Sometimes it's not physically or socially available to everyone. And so this is all based on privilege. It's been a top down concept led by academics and government. So there's little room for balancing concepts and lived contexts of populations to be assisted. We focus on critical health literacy, recognizing social contexts must be incorporated. So it's largely been used by academic and government officials, but this doesn't leave room for people and their lived experiences. It assumes knowing the facts and words leads to solving challenges, but we might know the facts and the words, we just might not know how to solve things. And it asks, what is an informed decision? So who decides what the relevant facts are? So to boost health literacy, focus on interpreting scientific into information not as an end. So we should focus on interpreting scientific information not as an end to solving the problem, but as something that's helping us solve the problem. It should be as a means of helping to consider recommendations and guidelines. Let them weigh it against their beliefs, values, and unique situations. It also values even basic levels of understanding. So avoid stigma for those without resources, formal education, or lived experience to interpret or act on technical information. So we should avoid that stigma. It's not their fault. They're trying to understand. And it provides experts with context of their audiences to help them be more flexible, right? So they can be more flexible with those who don't necessarily understand right off the bat. All right, so that was health literacy. Again, I know the thing says health culture on the very first slide, but it's health literacy. Next, we're going to talk about health communication and bias. I'll see you in the next video.